This is Dr. Katrina Bell, a trauma and orthopaedic surgery resident from the Royal Infirmary of Edinburgh, and I am speaking to you about our JBGS article entitled "The QuickDASH and PRWE are not optimal patient-reported outcome measures after distal radius fracture due to sealing effect. Potential implications for future research." Now, my co-authors and I would like to thank the JBGS for allowing us to highlight our work through this Author Insight series. So the question that we're going to discuss today is, what remains the most important unanswered question about your study, and how do you hope to address it? Now, our main conclusion is that both the Quick Disability of the Arm, Shoulder and Hand score, the QuickDASH, and the Patient Rated Wrist Evaluation, the PRWE, demonstrate sealing effects when used to assess the outcome of distal radius fracture patients. So despite achieving sealing scores, we found that some patients still did not feel their wrist was normal, and this was in terms of its look, feel and its function. And this was more of an issue in those of male sex, younger age, dominant hand injury and those with better health-related quality of life. So the most important question unanswered by our study is there a patient-reported outcome measure that does not have such a marked sealing effect? Now, currently, both the QuickDASH and PRWE are the most commonly used outcomes, or patient-reported outcomes rather, to assess outcome following fracture of the distal radius. And they've been extensively tested for validity, reliability, feasibility and responsiveness. But despite this, as we've identified, sealing effect is an issue. However, at the moment, we really don't have an outcome measure that is superior to assess the outcome of this injury. Computer adaptive designs have been suggested as a potential alternative to a single questionnaire, but they do require considerable resources to deliver, and this can be a barrier to completion and uptake. Any new outcome measure needs to be able to differentiate between the ability to carry out more complex and challenging activities, which would demonstrate a higher level of function, from the ability to carry out tasks which could be considered as more core tasks of day-to-day living. Also, day-to-day life evolves rapidly and certainly has since both the QuickDASH and PRWE were designed, meaning that some of the activities featured are no longer really applicable to modern day-to-day life. Additionally, many outcome measures were designed to assess improvement following elective surgery and not really the return to function after trauma, which is what we're looking for. And these are all factors which our team have in mind as we try to help develop a new outcome measure that will best serve our trauma patients. Thank you.